Now we commence the press conference by Prime Minister Suga. We hear from the Prime Minister first. Floor is yours. Shortly before, we held a novel coronavirus response headquarters and we discussed the state of emergency declaration. Hokkaido, Okayama, Hiroshima prefectures will be added to that. It starts from 16th of May to 31st of May. We discussed that, and as far as the priority measures is concerned, Gunma, Ishikawa, Kumamoto prefectures will be covered by that measures. That starts from 16th of May to 13th of June. This was approved in a meeting. Infections across Japan differs from region to region. Rapid infection is still, however, increasing in some regions, and new infections in Osaka started to decline. In Tokyo, however, it remains the same. Aichi, Fukuoka prefectures are seeing the surge of infections. Against the backdrop, the popularized areas such as Hokkaido, Okayama, Hiroshima prefectures. These areas are seeing the rapidly growing number of infections. So far, we have to work together with the local governments of these prefectures, having taken necessary measures. And this morning, there was a task force experts meeting, and experts say much stronger measures will be needed. That's the view that has been shared in the meeting. And variants are expanding in this country. Now is at the crossroads to contain outbreak, and our thoughts remain unchanged. We respect all views of experts. Therefore, we decided to add those prefectures to the state of emergency. The terms will end on par with the other prefectures, including Tokyo, which is the 31st of May. And again, in a due course, we will make our right decisions. Regions covered by state of emergency has worked together with each local government, and alcohol offering and karaoke offering services will be suspended, and teleworking need to be permeated thoroughly with a sense of urgency. Powerful measures will be taken in those regions. Regions by priority measures. The bars and restaurants have shorter operations, and the patrol groups will offer services across the towns. And alcohol beverages won't be offered in the restaurants and bars. These will be the measures possible in those regions on the par with the regions with the state of emergency declaration. Starting this week, one by one, little by little, full-scale vaccination program has been rolled out. Each of us lives will be protected by those vaccines, and this is a trump card for those visions. Local governments and medical professionals have given us a cooperation. So 85% of Japan, that is 1,490 municipalities, up until the end of July, we planned to finish the vaccination program for all the elderly in those regions. The university, hospital, and the local governments have worked together to set up large-scale vaccination centers, and these moves have been advanced so far. moving forward, we will give assistance and support to all the governments so that everybody can be vaccinated as soon as possible. And that's the initiatives we will be moving forward.
On top of that, in next month, starting with the municipalities to complete the elderly vaccination, those of underlying health conditions and general public, the inoculations will start. And the businesses in nationwide, we get the industrial support of industrial doctors. The office workers also will be inoculated. In this environment, those who have challenges in getting a vaccine reservation, I deeply apologize for the inconvenience. However, we make sure that everyone will be inoculated by end of June. We secure 100 million doses of vaccines, and with the local governments, we work together hand in hand. And in the nursing facilities, the workers, day in, day out, make an all-out effort. I sincerely appreciate your effort. Early as possible, safe and secure daily life will be restored, and for that, we accelerate the vaccination. In meantime, the countermeasures will be thoroughly implemented, and the infection situation of all regions will be contained as much as possible. For that, masks, hand washing, and preventing 3Cs. These essential prevention measures, I again ask to you, especially the conversation without wearing masks. It is taking majority of the cause of infection, according to a survey. The dining, drinking, conversations, and also in office and workplaces, each one of us need to wear masks in order to prevent the infection. This has a big power. I sincerely ask for your cooperation and support. That's all from me.
Now we would like to entertain questions from the floor. I asked Dr. Omi to move to the prescribed position, and Dr. Omi might answer to your questions. If you're appointed by MC, please approach to the closest mic. Please state your name and affiliations then, and please ask one question. First, two leading media outlets. Kyodo Press, Yoshida-san, move ahead.
共同通信の
Yoshida, Kyodo Press, thank you. Today, Basic Policy Subcommittee was held today, and with the view of experts, originally we didn't assume the state of emergency. However, 3 prefectures are now added. And don't you think your view and your prediction was too conservative? How do you counter those voices? And don't you think you didn't prepare and consult with the experts well? Even 3 weeks after the state of emergency, the EU cannot contain the outbreak. Even with that, the infections are rising and spreading to the regions. How do you see the current situation, please, Prime Minister? Well, as a Japanese government, the infections across the regions need to be the basis for the precautionary measures against the virus. And we have conferred with those experts meeting. And that's where we hear opinions, views from the experts, and we properly have taken actions. And this morning, in a subcommittee meeting, much powerful messages need to be announced, need to be communicated. That's what the voices are raised in the morning. So reflecting to that, the prefectures with much population will be subject to much impact. So these prefectures will be added to the list of a state of emergency declaration. It's been 3 weeks since the previous state of emergency. However, in Osaka, new infections started to go south. And looking at our eyes to Tokyo, it has remained quite the same. We need to contain outbreak, so we need to take all-out measures to do that. Dr. Omi, would I possibly gain your comments, please? Well, experts and Japanese government, especially myself and Minister Nishimura, on a daily basis, I exchange opinions with him and with experts to share how much vigilant we need to be. And of course, between the governments and experts meeting, the positioning and perspectives are of course different. So looking at the discussions, each discussion and theme, of course, sometimes views are different. And today, ideas were confirmed to this experts meeting. And Hokkaido, Hiroshima, Okayama prefectures were something that we have given the ideas. But there are 4 points we needed to stress. First, these 3 prefectures, in other words, Hokkaido, Hiroshima, Okayama, comprehensively, they were standing in a stage 4. That's one thing we needed to draw out. And second, there is an impact of the variants, and it started to come into the fore. And already, infections have been spreading, but even further infection spread is a threat. And third, how overwhelmed the beds are. Of course, it's already in a tight spot in terms of the numbers, but the reality is much harsher than what the figures are displaying us. So that's a judgment we made as experts. And fourth, as the Prime Minister Suga said, declaration of a state of emergency is much stronger than priority measures. This powerful message is necessitated to recover the current state. So these are the 4 points we needed to stress. And we need to give a straightforward message to the government, and that's the responsibility we need to bear as experts. And in much earlier on, the government has adopted our views.
はい、続きま
Next, Shimizu-san from Tokyo Shimbun, please. Shimizu from Tokyo Shimbun, Chunichi Shimbun, regarding Tokyo Olympics and Paralympics and the burden to medical capacity. The Games Organizing Committee will designate hospitals for the athletes and related parties when they are infected with COVID-19, but the medical side says that they don't have any room to do that. And can this capacity be established? And your statement of a safe and secure games, public have a skeptical sentiment about it. And the evaluation should be required for the medical capacity and readiness in order to protect the lives and livelihood of the people. The concrete standards should be established, and based on the science, the holding of the games should be decided. What is your take on this? Regarding Olympics, various opinions are there. I acknowledge. First, we need to contain the spread of the virus and protecting the life and the livelihood of the people, which is utmost priority at any rate. The athletes and the related parties, infection prevention measures will be completely established, and they can participate the games with a peace of mind, and at the same time protecting the lives and the livelihood of the people, which is a basic thinking for the holding of the Tokyo Games. For the medical capacity for Tokyo Games. It will not be a burden to a local medical readiness and capacity. Now the preparation is being made, and now the organizing committee is securing the designated hospital, and also the idle nurses and the sports doctors. We are calling for their support. From Pfizer to athletes, free of charge vaccine will be offered, and for athletes related parties and Japanese people will not be mixed, and we are now establishing these concrete measures. These initiatives will be thoroughly implemented, and the life and the livelihood of the people, Japanese people, will be protected, and I think it is possible to hold the safe and secure Olympic and Paralympic Games.
幹事社以外の方からご質問
We will take questions from the other media outlets. Please raise your hand in asking questions. I'll point out the reporters. Then please approach the closest mic. Then Sanai-san from NHK.
NHK の幼い
Osanai, NHK. This is a question to Prime Minister. Following last week, you have expanded the scope of a state of emergency declaration. The variants are expanding across Japan, and the National Governors Association said that these measures should be expanded across Japan. How do you see that? Well, experts have said on the infection status, and this is not nationwide outbreak. There is a huge delta across the region, and infections are rising rapidly, and hospital beds are in a tight spot, and that's what the experts have voiced so far. So based on these regional infection status, we cannot describe that the broad brush with these regional across Japan, but the effective measures need to be taken, which will be important. Dr. Omi, would you have any comments on that? Yes, across Japan, state of emergency declaration should be issued or not. We have had this kind of discussions on that, but no one has stressed that today. Why? Because looking at Japan as a whole, the effective reproduction rights currently 0.99, and many prefectures are seeing the surge of infections. But still, some regions are seeing the recovery of those infections. So we deem the current situation as a not nationwide outbreak, especially the areas with a popularized area such as Hiroshima or Okayama prefectures. And these are the areas that started to show the ripple effects of infections. So these more popularized areas are the sources. So that's why we made up proposals to add those prefectures. Of course, the situations will vary. If the situation will go decline and go worsen, of course, that's the possibility moving forward as a possibility. But today, among the experts in the meetings, no one had mooted the proposals.
それ
Otsuka-san from GG, please. GG Press, I'm Otsuka, Tokyo Olympics and Paralympics. And there are recommendations from the parties that it should be postponed to fall season considering the vaccination situation. What is your take on this? Current spread of infection should be contained, and we make an all-out effort for Tokyo Olympic Paralympic Games. IOC has already decided the holding of the game at the set period, and due preventive measures will be taken to prevent the infection so that we can hold safe and secure Olympic Games, and at the same time, we can protect the lives of the Japanese people. Through these measures, we protect lives and the livelihood of Japanese people and realize safe and secure Olympic and Paralympic Games can be held, and that's what we are going to do.
では奥の列で
Other questions? Morioka-san of a freelancer, please. Okawa-san of a freelancer, please.
フリーライターの大川工業総裁岡井隆です。菅総理を
Prime Minister and Dr. Omi, thank you for your efforts, and thank you for the translator in the nurses in these facilities for handicapped facilities are bringing those viruses sometimes. So as a third priority, those vaccinations need to be spread and need to be expanded to those healthcare workers. In Hokkaido, rather than restaurants and bars, in these caring facilities are seeing more surge in infections. And sports watching and a theater, spectators have cooperated on the anti-infection measures before and after games. So I expect you to take some experiments and attempts to see the effectiveness, to get the learnings to lead up to the Olympic Games. How do you see that? Well, vaccination program by the end of July. The second shots need to be completed by the end of July. And the municipalities around by the middle of June, those handicapped people need to be included to be shorted jobs, and much broader general people need to be vaccinated. That's the plan, desirable plan. But once we see the good visibility for the vaccination program for the elderly, of course, we would like to think about the plans for these caregiving facilities. And following that, general public will see opportunities to be inoculated. As I said at the beginning, this vaccine is a decisive move to protect each one of us lives. We will do all we can to do that. Yes, theater and sports club and others. I guess you have raised the questions on the state of emergency, which required stronger measures, including department stores. And you might wonder why these measures are taken without any clusters. Of course, there are several cases of clusters in department stores and others, but it hasn't happened every single day. And as I said many times, the current variants and current infection spreading speed, those need to be stemmed and curbed. That requires less contact between people and cut and decline on human traffic. So we are in a situation where those measures are required because little by little, it started to difficult to gain cooperation from the general public, and more diversified places are seeing those clusters, and there is a presence of the variants, and that's why state of emergency comes in. And of course, we cannot do this for good. Sooner or later, general public might have hoped and might hope those lives need to be ended, which will be saved by vaccine. And so far, we have depended on the behavioral change for general public. But moving forward, that will be the vaccine or strategic antigen test kits. So science and technology at present need to be capitalized on. We started to see the groundwork for that. So in parallel, not only vaccine, but testing including PCR testing or antigen testing kits, needs to be utilized well in many places, and those will be contributor for people to go back to normality. So we encourage Japanese governments to work on these two things, testing and vaccine. And in case that we lift the state of emergency and infections are rising, then we need to look at rebounds. One of the challenges we face at Japan is that how fast we can move once the rebound emerges. So up until the vaccines will be rolled out to the elderly people, a few months later, we need to do all out on that.
下久保さん from 中国新聞 please. 中国新聞 I'm 下久保. In the Chugoku area, neighboring prefectures Hiroshima and Okayama were declared on the state of emergency, and original PCR test and also short operation hours request and also prefectural people worked hard, but the state of emergency was declared. And what is your take on this? The timing of the decision, it is Friday on 14th. It was decided and it will be implemented on 16th. So there is a sudden notice and people are a bit taken aback. And what do you think of that? And the priority measures and the state of emergency were not placed in the due timing or the required timing as the local people wanted. What do you think of this? This time, Okayama Prefecture and Hiroshima Prefecture. In Hiroshima City and Okayama City, in each prefecture, they had an original decision. And shortened operation hours just started. As the central government, based on those situations, based on the priority measures, not just the shortened operation hours and stop serving alcohol, that can be practiced with the priority measures. Those powerful measures we wanted to take, but on the other hand, at the subcommittee, experts said that the stronger message is necessary. That's their opinion. But these two prefectures, the rapid spread of infection is taking place. So subcommittee experts' opinion is what we decided to take as the central government, the density populated area, and there is a sense of an urgency. That's why we decided to declare state of emergency. But in each local area, they have a different opinions and situations. And in each unique situation, the prefecture unique measures, which is the shorter operation hours, has just started. So in the beginning, we were thinking about priority measures, but experts sent us an opinions, and the variants are rapidly increasing. That was a comment raised by an expert. Therefore, as a central government, state of emergency to be declared. That was our decision. May I hear from Dr. Omi? Hiroshima Prefecture, PCR, a wide-ranged test is taking place, has been practiced, but why the infection is increasing? That is your question. In the local communities, wide-range PCR testing, there is a significance. What is the significance? At that time, certain time, the situation of infection can be surveyed in the wide range, and Hiroshima found out various things, and what we received, it really made sense to us, and that is one of the trigger that for us to decide to use the antigen test, and it was a wide test. There are a lot of asymptomatic cases and some had symptomatic cases. So asymptomatic people and symptomatic people, the positivity rate is very different. Asymptomatic cases around 1% and 10 times higher positivity rate for the symptomatic cases. So that we need to do this very frequently if we try to control the infection situation using this. And doing this once have a significance. And the monitoring surveillance is now being conducted, and probably less than 1%. The positivity rate is very low, but there is a significance. But in order to prevent the increase of the cases, we need to concentrate this kind of a practice. So light symptomatic cases, a mild symptom, persons have a higher positivity rate, and therefore the surroundings or peripherals of those cases have a higher positivity rate. So the wide range test and also focused range test, there are difference in the significance, and local governments should understand those differences.
それでは産経新聞
杉本さん from Sankei newspaper. Sugimoto from Sankei newspaper. My question's on the impacts of the state of emergency. Tokyo, Osaka were covered by state of emergency. It's been already 3 weeks. Especially in Tokyo, new infections haven't declined. And versus other 2 state of emergencies, we cannot necessarily see the desirable impacts of the state of emergency. In order to see the impact of the state of emergency, how do you see the possibilities to have a more powerful measures? For example, you can correct a non-penal fine from restaurants and bars who are not following. But would you like to make an approach for these measures more than ever? Well, in Osaka, covered by state of emergency, over the past few days, new infections started to decrease. In Tokyo, remained stable. With that, already in Tokyo, restaurants and bars who cannot follow these measures, penalty measures might be included, and special requests were sent based on Special Measures Act. We have ramped up the systems in Tokyo for that, and we properly act on those cases moving forward as well.
はい、それでは
Nanao-san from Duango, please. Duango and Nico Nico Doga. This is Nanao. Thank you very much for your effort. According to WHO, in India, the variants that's triggering a spread of an infection, in more than 44 countries, these variants were detected. In Southeast Asia, it started to spread, and at this point, the worst case scenario, one of the worst case scenarios, this highly infective Indian variant may increase. And based on that, what is short in India, the medical oxygen unit securing those oxygen equipment, and also the concrete method. What can we take? That is my question to Prime Minister. And in order for us to have a higher sense of awareness, to Dr. Omi, I would like to ask about the possibility of a replacement to the Indian variants in going forward. Starting with myself, in Osaka and Hyogo, the medical capacity is strained. We continue to see the situation. The COVID-19 patients hospital, we are supporting them strongly, and the central government and Osaka prefecture as a one team, we are securing hospital beds. 900 hospital beds were secured in April and after, but still the strained situation continues, and the medical oxygens, the supply volume, we have an ample supply currently, but we continue to monitor the situation, and it will be supplied to those who need it. We continue to work on that, and we now have a secure volume. Your question is about the Indian variant, if it replaces the existing strains. Relatively solid survey is conducted on a UK strain for UK. The UK strain was a mainstream, and in the UK, Indian strain is increasing. That's what we started to find out. It is increasing gradually. In Japan, inside Japan, we sporadically identify Indian variants. So Indian strain gradually may surpass or replace UK strain. The possibility, there is a possibility. And 40% of monitoring, I think we virtually achieved this surveillance, and we now have a resource, Indian strain monitoring. I think we should gradually ship the resource for the Indian strain surveillance.
Koyama-san from Mainichi Newspaper, go ahead.
毎日新聞の小山
Koyama, Mainichi Newspaper, thank you. Okayama, Hiroshima prefectures and Fukuoka prefectures were issued a state of emergency without being issued by priority measures. And in a flexible manner, priority measures will be operated, you said. But some people said you haven't done that necessarily. Why? And you would like to see the discerned effects and impacts of prefectures' own measures. But some prefectures cannot necessarily cap on some lives based on the Article 24, and they would like to be supported by the government to cap on some liberty. How do you see that? Well, first, to your question on priority measures, this is the constraints on the private liberties with the penalties. On the supplementary resolutions of the diet, the priority measures were discussed, and the rights and freedom caps on people need to be minimum. This is something that we need to give more attention. That's been stipulated in supplementary resolutions already. Therefore, as a government of Japan, the shorter operations were forced in bars and restaurants. We need to see the effects with the priority measures. That's one thing. And this time, as I have stated, new infections have been rapidly increasing this week. So The subcommittee meeting took place today, and that was where the experts asked for the state of emergency. So that's why that is exactly the decisions we made as a government.
それでは
Miss Egawa, freelance, please. I am Shoko Egawa, freelance. On Olympic Games, the government, regarding protecting athletes, you have various measures, but other than athletes, there are greater number. The maximum 90,000 non-Japanese will visit, according to a source, and some press said that the non-Japanese press and media raised a question about doing various activity, including interview. The people other than athletes have various restrictions and border control and also self-isolation. People may not follow the request of self-isolation, including the Olympic-related parties and also the press and media. Those people will stay at the private hotels, and there is a lot of chances of they being mixed with the Japanese public. And I would like you to show us in concrete steps and measures how it can be prevented. And to Dr. Omi, the in advance evaluation to the medical capacity, for the burden of a medical capacity should be made. How will the central government respond to this when it needs to be evaluated? The criteria and also the ground, will it be shared and with the Japanese people? And also to Dr. Omi about the reason of the necessity of evaluating the burden to medical capacity. First, in the earlier question, the media person, about 30,000 individuals will arrive at Japan. Now, those who are coming to Japan, we examined, and those numbers will be much smaller than the last examination, and their activities will be restricted, and if anybody violates those restrictions, we force them out of Japan. That's what we are considering right now. So Japanese general public and the related parties will act, will move in a different route, and designated hotel from the government. Specific hotels will be designated so that they will not be mixed with the Japanese people. We are in the process of those preparation. I'm sorry, please refrain from commenting from your seat. Regarding the evaluation for the infection risk and also a burden to medical system, that is my another question. When we establish this policy for the activity, we invited two of an experts to consult with. Regarding your question, why the burden to the medical system need to be conducted? Regardless of an Olympic, people have an anxiety because the infected cases, rather than infected cases, the strains on medical service, the general medical service is being challenged, and the necessary surgery operations need to be postponed. So now it is to the matter of the lives of Japanese people and regarding a strain on the medical services, because the medical resources need to be directed to the vaccination. And if we receive many people, a certain rate, there are some rate of sickness may occur with or without COVID. So what I've said is the Olympics and the Paralympics related parties will make some decision at some point. And if the game is held, it is not the day before, the X weeks, X days, or X month, with a certain leeway of time, that decision is made, and the burden to the medical services can be reasonably estimated if it's a good situation or moderate situation. Depending on the situation, if the Olympic Games are held, then in X weeks later, how much burden is estimated? If the situation is not good, it's going to be an extra burden. So that sort of evaluation, I think it is a responsibility of those who are holding Olympic and Paralympic Games.
それでは大変恐縮でございますけれども、あと1問。
I'm afraid the next question will be the final one. The international media. Tom Williento News as a Harley-san. Go ahead. This will be the final question. Thank you. To Japan and the world. What are the advantages and disadvantages of having Olympic Games, and how do you strike a good balance between those advantages and disadvantages? Thank you.
オリンピック・パラリンピックは
Well, Olympics and Paralympic Games are the largest festival on this planet, and this will give the hope and courage to people. Given the backdrop of infections are rising, there are various concerns and voices of people for Olympic Games, but anti-infection measures need to be implemented for the Olympic Games so that with a relief and peace of mind, people need to be participating in those games so that we can protect the life and livelihood of the people. This is a basic stance of the government of Japan. Thank you.
Please. Hokkaido Shimbun, I'm Sato. In Hokkaido, before the Golden Week, the variants are acting as a trigger of an increase of an infection, but the measures were applied from May 6th, and the state of emergency declaration was decided based on the opinions of the experts. So the actions toward Hokkaido repeatedly, they were late. And I have a same question to Dr. Omi. The necessity of a state of emergency to Hokkaido, you mentioned already. But do you see that the actions were taken later than it should? In Hokkaido, as the central government, every day we coordinate and we work with Hokkaido. As you know, it is bigger than double of Kyushu, and in Sapporo City, about 70% of an infection cases are concentrated in Sapporo City. Therefore, the priority measures in a focused manner, we can implement. And the government had a perspective that will be effective. With the priority measures, can also implement the force measures. But the subcommittee experts said we need a stronger message that was pointed out. Therefore, we decided to declare a state of emergency. That is the course. You also had the same question to me. The state of emergency, it is restricting private rights. It is a serious decision. And I think there are various opinions about this. It was too late, and so on. And from my perspective, we had an advisory panel meeting, and considering the current situation, we need to declare it now in order considering the burden on medical services like Osaka. Therefore, today we stated our opinion, and the government has adopted our opinions. So what we have decided, we need to work as a one body in a focused manner. Thank you. With that, we conclude today's press conference. I'm sorry. Please refrain from commenting from your table. Those who are raising the hands and were not invited, please send us your question via email, and we will reply in a written format to your question, and we will also post that on our website. Thank you very much. Today, with that, we conclude the press conference. Thank you.